Minister, a year has now passed since this House unanimously supported a motion to extend special support for all frontline workers suffering from long COVID. And a year has passed since you, Minister, promised to look at the plight of such workers. But we're still no further along, and those commitments remain unfulfilled. Today I stand before you to reiterate the urgency of this matter and to call for immediate action from the Government to address this issue. And as you know, Minister, the Department of Health and the HSE has agreed to extend special payments for a period exceeding 28 months to 143 healthcare staff afflicted by long COVID symptoms. So the State has acknowledged that in the case of 143 healthcare staff that they have an occupational illness of long COVID after contracting COVID, in all probability within their place of employment. But they are still being denied access to an occupational illness scheme because the State is still refusing to publicly acknowledge that staff are chronically ill as a result of COVID infection. And Minister, I want to know what's going to happen on the 1st of April when these staff are unfit to return to work, particularly when their employer had sought a 12-month extension of those support payments to November of 2024. And what about the staff that have been excluded from these supports? Every other frontline worker outside of the health service that is out with a chronic illness as a result of long COVID is getting no additional occupational support. And those within the health service who were infected since the 15th of November 2021, during the height of the Omicron variant, are unjustly again being excluded from the support that the 143 workers are receiving. We ask that these individuals who run our hospitals, run our supermarkets and support people with disabilities to go out to roll up their sleeves in the interest of the country at the height of the pandemic. And these dedicated individuals who contracted long COVID as a direct result of their heroic efforts during the pandemic are now being denied the support that they rightfully deserve. Now we're turning our backs on them, and Minister, this is neither fair nor right. We must treat all workers equally, and to do this we need to see long COVID designated as an occupational illness for all frontline workers who contracted the virus during their employment. And during committee stage of this bill, Minister, I will be bringing forward, along with Deputy Cathal Berry, an amendment to try and progress that, because we do need long COVID to be designated as an occupational illness. Many of these workers have incurred significant financial costs in managing their illness without any state support. And this has also impacted on the labour force itself, with many patients, often young, previously healthy, experiencing prolonged multi-system symptoms, which is impacting on their daily lives, impacting on their ability to work. Some of them are only working on a part-time basis, and we really do need to address this issue, Minister.